There is a reason this feeling can wear people down so much. You swallow, and it still feels like something is sitting there. You clear your throat, and for a second it seems better, then the feeling comes right back. Some people describe it as mucus. Some say it feels like a lump. Others say their throat never feels fully clean, no matter how often they cough or swallow. And what makes it even more frustrating is that it can happen every single day, even when you are not sick. I am Dr. Warren Hung, a medical doctor, and this is one of those symptoms that gets brushed off far too easily. If you like clear health explanations without confusing medical language, subscribe and stay with me. What makes this so confusing is that people usually focus on the mucus itself, as if the mucus is the problem. In many cases, it is not. The mucus is often the body's response to something else. It is there because your throat is trying to protect itself. That is the part people often miss. Think of mucus as a protective coating. Your body makes it to trap irritation, hold moisture, and shield delicate tissue. That means when you keep feeling mucus in your throat, the bigger question is not only, why am I making mucus? The bigger question is, what is irritating my throat enough that my body feels the need to keep protecting it? That simple shift changes everything. Because the truth is, that feeling in your throat does not always mean your body is producing huge amounts of mucus. Sometimes it means the mucus is thicker than normal. Sometimes it means the throat is dry and sensitive, so even a small amount feels exaggerated. Sometimes it means material is draining into the throat from the nose. And sometimes it means irritation is coming up from the stomach and reaching the throat in a way people do not expect. So when someone says, I always have mucus in my throat, there are really several possible stories hiding underneath that sentence. One story starts above the throat. The nose and sinuses naturally make mucus all day long. Most of the time, you do not notice it. It stays thin, it moves quietly, and your body handles it without calling attention to itself. But when that balance changes, the mucus can start collecting or draining in a way that becomes hard to ignore. Another story starts below the throat. This is where stomach acid or stomach contents irritate the throat, sometimes without the person feeling classic heartburn at all. That can create a constant need to swallow, clear the throat, or cough lightly over and over again. And then there is the throat itself, a throat that is dry, inflamed, overused, or repeatedly irritated. Knowing your crease can become extremely aware of normal sensations. That means even a small amount of mucus can feel like too much. The throat becomes sensitive, and once that cycle starts, it can keep feeding itself. That is why simply trying to get rid of the mucus often does not solve the problem. If the irritation stays there, this no san fismok stays near, the signal stays there too. This is also why throat clearing can turn into such a frustrating trap. So it feels useful for a moment, and it gives a brief sense of relief, but every time you force the throat together sharply, you create a little more friction. That can irritate the lining even more. Then the body responds with more protection, more sensitivity, or more mucus. So the thing that seems like the answer can slowly become part of the reason the feeling keeps returning. Have you noticed whether it feels worse first thing in the morning, after eating, or when you talk a lot during the day? That pattern matters more than many people realize. Because timing often gives clues about where the irritation is coming from. Morning symptoms may point in one direction, symptoms that flare after meals may point in another. Symptoms that get worse in dry air, during allergy season, or after repeated throat clearing tell a different story. The throat may feel like it has one problem, but the source is not always the same. And that matters, because the right solution depends on the real cause. If the mucus feeling is coming from drainage, you need to think about the nose and sinuses. If it is coming from reflux, you need to think about what is rising into the throat. Not sheer ends. If the issue is dryness and irritation, you need to calm the throat. And reduce the triggers that keep setting it off. This is why I always tell people not to reduce this symptom to something small or harmless just because it sounds ordinary. A constant mucus feeling in the throat may not be dangerous in many cases, but it is still a message. The body is usually reacting to something. Your job is not to fight the message over and over. Your job is to understand what is provoking it. And once you start looking at it that way, one of the most common sources becomes much easier to spot. Because in many people, the problem is not stuck in the throat at all. It is slowly moving into it from somewhere just above. One of the most common reasons people keep feeling mucus in the throat is something called postnasal drip. The name sounds simple, but the experience can be surprisingly stubborn. It does not always feel like a runny nose. It does not always come with obvious congestion. And that is exactly why people often miss it. Your nose and sinuses are supposed to make mucus all the time. That is perfectly normal and healthy. This mucus traps dust, and pollen, germs, and tiny particles before they move deeper into the body. Under normal conditions, it stays thin enough to move quietly, and you usually swallow it without ever noticing. The problem starts when the mucus becomes thicker, the tissue becomes irritated, or the drainage pattern changes. Instead of moving in a way that stays unnoticed, the mucus begins to collect and slide down the back of the throat. It shows day midi akintat. That can create a constant feeling of coating, fullness, or the need to swallow. Some people describe it as slime. Others say it feels like a film they cannot get rid of. And because it sits right where swallowing and speaking happen, it can become hard to ignore. This is one reason the symptom can feel worse at night or first thing in the morning. When you lie down, gravity changes the way mucus moves. During sleep, drainage can pool more easily in the back of the nose and throat. Then you wake up feeling like your throat is coated, irritated, or packed with mucus, even though the real source is higher up. Allergies are a major reason this happens. When the lining inside the nose reacts to pollen, dust, mold, pet dander, or other triggers, it becomes inflamed. That irritation tells the body to make more mucus. At the same time, the mucus can become thicker and harder to clear smoothly. So now you have two things happening at once. Sensory, exercise, more production, and less comfortable drainage. Dry air can do something similar. This surprises people because they assume dryness would mean less mucus. What often happens instead is that the tissue becomes irritated and the mucus becomes stickier. So the body keeps trying to protect the area, but the result feels heavier and more noticeable. Heated indoor air in winter, air conditioning, and poor sleep conditions can all play a role here. Weather changes can matter too. Some people notice the symptom gets worse when the air shifts, when there is more wind, when pollen rises, or when cold air dries the nasal passages. Others feel it more after cleaning dusty spaces, being around smoke, or spending time in rooms with strong fragrances. The nose does not have to be fully blocked for the throat to feel the result. This is where many people start clearing their throat over and over. It feels like the fastest way to get relief. But if the source is ongoing drainage, the throat clearing only deals with the sensation for a moment. The mucus or irritation comes right back. And it's your sur and ansolzir and bolke. And then your ansol and the repeated clearing can irritate the throat enough to make the whole thing feel worse than it really is. That cycle matters. Drainage irritates the throat. The throat feels coated. You clear it. The throat gets a little more irritated. That irritation makes the sensation stronger. Then you clear it again. Before long, it becomes hard to tell where the original drainage ends and where throat irritation begins. Sinus inflammation can push this even further. If the sinuses are swollen, irritated, or not draining well, mucus can become thicker and linger longer. Some people also notice facial pressure, reduced smell, frequent congestion, or headaches. Others mainly notice the throat symptom and do not connect it back to the sinuses at all. That is why this can go on for weeks or months before someone realizes the problem may not be in the throat itself. The practical side of this is important. If drainage is part of the reason you always feel mucus in your throat, the answer is often not to keep forcing the throat clear. It is to reduce the irritation that is making the drainage worse. Drinking enough water can help thin mucus. Saline rinses or saline sprays can help wash out irritants and support smoother drainage. A humidifier may help if the air in your home is dry. Reducing exposure to smoke, heavy dust or strong scents can also make a difference. And if allergies seem to be part of the pattern, that is worth discussing with a healthcare professional. It is also important to know when not to shrug this off. If you have a fever, strong facial pain, or blood in the mucus, trouble breathing, trouble swallowing, or thick discolored drainage that does not improve, that needs proper medical attention. The same is true if the symptom just keeps going and going without a clear reason. But even when postnasal drip is part of the picture, it is still not the whole story for many people. Because sometimes the throat feels coated for a completely different reason. The irritation is not falling down from the nose at all. It is traveling upward from somewhere people do not usually suspect. And that is where the pattern starts to change in a very different way. There's another reason people keep feeling mucus in the throat. And this one catches many of them off guard because it does not always feel like heartburn. In fact, some people with constant throat clearing, hoarseness, coughing, or that coated feeling in the throat will tell you they never feel any burning in the chest at all. That is why this cause gets missed so often. What I am talking about is reflux, especially the kind that irritates the throat, without producing the classic signs people expect. Most people think reflux always announces itself with obvious acid burning. A sour taste or discomfort behind the breastbone. Sometimes it does, and people definitely feel those classic signs. But sometimes the material from the stomach travels upward in a quieter way, and mainly irritates the throat, the voice box, or the upper airway. And the throat is not built to handle that irritation very well. The stomach has a protective lining designed to tolerate acid and digestive activity. However, the throat does not share this same protection. So even a smaller amount of upward irritation can create a surprisingly strong reaction there. The tissue becomes inflamed. It may swell slightly. It may feel sticky, full, or sensitive. And the chen sentin and shen sanses and insan. Being shens, the body responds the way it often does when tissue is irritated. It increases protective secretions, which many people then interpret simply as excess mucus. That is why someone can say, I keep having mucus in my throat. When the deeper issue is not that the throat is randomly producing mucus for no reason. The throat may be reacting to something coming up from below. This can also create a very specific pattern. Some people notice the feeling gets worse after meals. Others notice it later in the evening. Some wake up with a heavy throat, frequent swallowing. Or a voice that sounds rough first thing in the morning. Some notice a lump-like sensation that seems to come and go. Others develop a dry cough that does not quite feel like a chest problem. And many find themselves clearing their throat over and over, never feeling like it is fully resolved. Does that sound familiar to you? Do you notice it more after eating, after coffee, or when you lie down at night? That timing can tell you a lot. Certain habits make this pattern more likely. Eating large meals late in the day can be one factor. Lying down too soon after eating is another. Coffee can trigger it in some people. So can alcohol. So can chocolate, mint, spicy foods, rich meals, or foods that seem to relax the barrier between the stomach and the esophagus. Not every person reacts to the same triggers, but the pattern often becomes clearer when people start paying attention to when the throat sensation is strongest. Body position matters too. When you are upright, gravity helps keep stomach contents where they belong. When you lie flat, that protection is weaker. That is one reason nighttime symptoms and early morning symptoms often raise suspicion for reflux-related irritation. Even if you never feel a dramatic burn, your throat may still be paying the price. This is where people often get trapped in the wrong explanation. They assume the throat itself is the problem, so they keep swallowing, coughing, or trying to clear something away. But if the irritation keeps rising from below, the throat never really gets a chance to calm down. It stays reactive, it keeps feeling coated, and the cycle continues. Another reason this can be confusing is that reflux does not always feel wet or acidic. Sometimes it just feels thick. Sometimes it feels like something is stuck. Sometimes the main clue is a voice that tires easily. A need to clear the throat during conversation, or a cough that seems to come from nowhere. When that happens, people may spend a long time thinking they have stubborn mucus, when in reality the mucus is part of a protection response. The practical side here is very important. If this pattern sounds familiar, it helps to look at timing and habits rather than only the symptom itself. Notice whether the sensation gets worse after dinner, after coffee, after spicy or heavy meals, or when you lie down too soon. Eating a little earlier in the evening may help some people. Smaller evening meals may help too. Some benefit from keeping the upper body more elevated at night, depending on their situation. And if reflux keeps seeming likely, it is worth discussing with a qualified healthcare professional instead of guessing your way through it. That matters because not every throat symptom is reflux, and not every reflux symptom should be self-managed without proper evaluation. Ongoing hoarseness, trouble swallowing, pain, weight loss, or symptoms that keep getting worse deserve medical attention. But even reflux is still not the full picture in every case. Because sometimes neither drainage from the nose nor irritation from the stomach is the main driver. Sometimes the throat itself has become dry, overworked, or overly sensitive. And once that starts, even a small amount of normal mucus can feel impossible to ignore. Sometimes the reason you always feel mucus in your throat is not mainly coming from the nose. It is not mainly coming up from the stomach. Sometimes the throat itself has become dry, irritated, or overly sensitive. And once that happens, even a normal amount of mucus can feel far more noticeable than it should. This is an important idea because many people assume that if they feel mucus, then the body must be producing a huge amount of it. That is not always true. In some cases, the bigger issue is that the throat lining is no longer comfortable. It is dry, inflamed, or constantly being disturbed. That changes the way sensations are felt. What might normally pass unnoticed now feels thick, sticky, or impossible to ignore. Dryness is one of the biggest reasons this can happen. If you are not drinking enough fluids, if the air in your home is very dry, or if you sleep with your mouth open, the throat tissue can lose some of the moisture that keeps it comfortable. Once the surface dries out, mucus tends to feel thicker and more stubborn. The body may even respond by trying to protect the area more, which can make the coating sensation seem even stronger. Mouth breathing during sleep is a very common part of this story. Some people breathe through their mouth because of nasal congestion. Others do it without realizing it. Then they wake up with a dry throat, a rough voice, and that familiar feeling that something is stuck there. The problem may not be a major increase in mucus at all. It may be that the throat spent hours drying out overnight. Certain medications can also contribute. Some medicines can dry the mouth and throat enough to make mucus feel thicker or harder to clear. Smoking and vaping can irritate the lining directly. Strong cleaning products, air pollution, heavy perfumes, or repeated exposure to dust can do the same thing. And if you talk for long periods, raise your voice often, or use your voice heavily for work, the throat can become more reactive over time. Then there is the throat clearing habit itself, and this is where many people unknowingly keep the problem going. Throat clearing feels useful because it gives a brief release. It feels like you are removing something. But mechanically, what you are really doing is bringing the vocal cords and throat tissues together with force. That repeated friction can irritate tissue that is already sensitive. Once the lining becomes more irritated, your awareness of the area goes up. Then, even a small amount of mucus feels like too much, so you clear your throat again. This is why some people feel trapped by the symptom. They are not imagining it. The sensation is real. But the more they react to it in the same way, the more the throat stays irritated. The body then produces more protective moisture or mucus, or at least makes normal secretions feel more obvious. What started as a response becomes a pattern. This is also why simple, gentle strategies sometimes help more than forceful ones. Sipping water may calm the sensation better than repeated throat clearing. Swallowing gently can sometimes help more than coughing sharply. Sugar-free lozenges may help some people keep the throat moist. Managing dry bedroom air can make a difference overnight. Reducing smoke, vapor, dust, or strong irritants can also give the tissue a chance to settle down. And one of the most useful things you can do is pay attention to timing. Does it feel worse in the morning? Worse after talking a lot? Worse in dry rooms? Worse during allergy season? Worse after repeated throat clearing? And those details matter because they help separate the possible causes instead of lumping everything into one vague symptom. That said, there are times when this should not just be brushed aside as irritation or dryness. If the feeling lasts for weeks without improving, if you have trouble swallowing, pain when swallowing, coughing up blood, unexplained weight loss, voice changes that do not go away, choking episodes, or symptoms mainly on one side that needs medical evaluation. Persistent throat symptoms deserve proper attention, especially when the pattern changes or becomes harder to explain. The mucus is often not the true problem. It is usually a clue. Your body is trying to protect tissue that feels irritated, dry, inflamed, or exposed to something it does not like. And for some people, that irritation is coming from the nose and sinuses. For others, it is coming from reflux. And for many, the throat itself has become part of the cycle. So instead of asking only how to get rid of the mucus, ask what keeps provoking it. That is where the answer usually starts. I am Dr. Warren Hung, and if you want more clear, simple health explanations like this, subscribe and stay connected. And if this throat feeling is something you have been dealing with, leave a comment and say when it feels worst, because that timing often reveals more than people expect.